The human body is a marvel of nature. It's a symphony orchestra, an intricate ensemble of organs, each playing a vital role in the grand performance of life. Each organ has its own rhythm, its own melody, contributing to the harmonious concert within. The heart, a steadfast drummer, sets the tempo with its rhythmic beat. The lungs, like a pair of bellows, provide the wind section, supplying the breath that fuels our every note. The digestive system, a diligent crew of instruments, works quietly yet efficiently, extracting nutrients from food like a conductor shaping raw sounds into beautiful music. And then there's the brain, the maestro of this grand orchestra, conducting this symphony with breathtaking precision. It orchestrates every beat, every breath, every movement, ensuring the performance goes on seamlessly. Within this intricate orchestra, the knees play a crucial role. They are the percussionists, bearing the brunt of our movements, providing the rhythmic foundation for our daily activities. They are the instruments of mobility, allowing us to walk, run, jump, and dance. They support our weight, absorb shock, and provide the stability we need to move through the world. The knee joint is a marvel of biomechanics, allowing for a wide range of motion while supporting the body's weight. This remarkable joint facilitates activities as simple as walking and as complex as a ballet pirouette. Each step we take, each bend of the knee, is a testament to the resilience and flexibility of this intricate structure. Imagine the knee as a finely tuned violin. The ligaments and tendons are the strings, responsible for the smooth and precise movement of the joint. The cartilage, a smooth, slippery tissue that covers the ends of the bones, acts as the rosin, allowing for frictionless gliding and preventing wear and tear. And just like a violin produces beautiful music when played correctly, a healthy knee allows us to move through life with grace and ease. However, just as a violin requires careful handling and regular maintenance, our knees also need attention and care. Overuse, injury, or the wear and tear of time can disrupt the delicate balance within the knee joint, leading to pain, stiffness, and impaired mobility. These problems are akin to discordant notes in an orchestra, disrupting the harmonious symphony of the body. Think of a dancer executing a perfect leap, their knees bending and extending with effortless grace. This fluid movement is a testament to the strength and flexibility of their knees. But what happens when a dancer experiences knee pain? It's like a sudden jarring note in a melodious piece, disrupting the flow and beauty of their performance. Knee pain is a common complaint, affecting people of all ages and walks of life. It can range from a dull ache to a sharp, debilitating pain, limiting our ability to perform even the simplest tasks. Understanding the common causes of knee pain is crucial for prevention and early intervention. One of the most frequent causes of knee pain is osteoarthritis, a degenerative condition that affects the cartilage. This smooth, protective layer, responsible for frictionless movement, gradually wears down over time like the strings of a violin losing their tension. As the cartilage deteriorates, the bones rub against each other, causing pain, stiffness, and inflammation. Another common culprit is a ligament tear, often the result of a sudden twisting or pivoting motion. This injury is akin to a violin string snapping under excessive pressure. The anterior cruciate ligament, ACL, and the medial collateral ligament, MCL, are particularly susceptible to tears, especially during sports that involve sudden changes in direction. Tendinitis, an inflammation of the tendons, is another frequent visitor to the knee's symphony of pain. This condition often arises from overuse or repetitive strain, like playing the same note on a violin repeatedly, causing the tendon to become irritated and inflamed. The patellar tendon, which connects the kneecap to the shin bone, is commonly affected, especially in athletes involved in jumping and running sports. Then there's bursitis, an inflammation of the bursae, small fluid-filled sacs that cushion the knee joint. Imagine these bursae as the mute on a trumpet, dampening vibrations and reducing friction. When inflamed, they can cause pain and swelling, hindering the smooth movement of the knee. Diagnosing the root cause of knee pain is like identifying a sour note in an orchestra. It requires a keen ear for detail, a deep understanding of the instruments involved, and the ability to differentiate between various discordant sounds. Physicians employ a combination of tools and techniques to pinpoint the source of the problem. The diagnostic process often begins with a thorough medical history and physical examination. The doctor will inquire about the nature of the pain, its onset, and any aggravating or relieving factors. They will examine the knee for swelling, tenderness, and range of motion, listening intently for any pops, clicks, or grating sensations. Imaging tests play a crucial role in visualizing the internal structures of the knee and identifying any abnormalities. X-rays, the workhorse of orthopedic imaging, can reveal bone fractures, arthritis, and other structural problems. Magnetic resonance imaging, or MRI, provides detailed images of soft tissues, such as ligaments, tendons, and cartilage, helping diagnose tears, inflammation, and other soft tissue injuries. In some cases, doctors may recommend blood tests to rule out underlying medical conditions, such as rheumatoid arthritis, an autoimmune disorder that can affect the joints. Analyzing the composition of the fluid surrounding the joint can also provide valuable clues about the cause of pain and inflammation. Just as a conductor relies on their ears and experience to identify a flawed note, doctors combine their clinical judgment with the results of these tests to arrive at an accurate diagnosis. This accurate diagnosis is crucial for developing an effective treatment plan and restoring harmony to the troubled knee. Treating knee pain is analogous to fine-tuning a musical instrument or repairing a damaged one. The goal is to restore the harmonious balance within the joint, allowing it to function smoothly and painlessly once more. Treatment options vary depending on the underlying cause of the pain and the severity of the condition. For minor aches and pains, conservative measures often suffice. Resting the affected knee, avoiding activities that exacerbate the pain, and applying ice to reduce inflammation can be surprisingly effective. Over-the-counter pain relievers, such as ibuprofen or acetaminophen, can help manage pain and reduce swelling. Physical therapy plays a crucial role in strengthening the muscles surrounding the knee, improving flexibility, and restoring range of motion. Just as a musician practices scales and exercises to improve their technique, targeted exercises can help rehabilitate the knee and prevent future injuries. These exercises are like the warm-up routines of musicians, gradually increasing flexibility and strength. In some cases, doctors may recommend injecting medications directly into the knee joint. Corticosteroids, powerful anti-inflammatory drugs, can provide temporary pain relief and reduce swelling. Hyaluronic acid, a naturally occurring substance that lubricates the joint, can be injected to improve mobility and reduce friction. These injections are akin to applying lubricant to a squeaky hinge, restoring smooth movement. For severe cases of knee pain or when conservative measures fail to provide relief, surgery may be necessary. Arthroscopy, a minimally invasive procedure, allows surgeons to visualize the inside of the joint and repair damaged tissues. In cases of severe arthritis, knee replacement surgery may be an option, replacing the damaged joint with an artificial one. This is like replacing a worn-out instrument with a new one, allowing the patient to regain mobility and live a pain-free life. The human body possesses an innate ability to communicate its needs, often through subtle cues and signals. Pain, in particular, is a powerful messenger, alerting us to potential problems that require attention. Learning to listen to our body's whispers, rather than waiting for them to scream, is crucial for maintaining our health and well-being. When it comes to knee pain, paying attention to early warning signs can prevent minor aches from escalating into debilitating conditions. Ignoring persistent pain or pushing through discomfort can exacerbate the problem, leading to more serious injuries and prolonged recovery times. Just as a musician can sense a slight dissonance in their instrument, we too can learn to recognize the subtle signs of knee distress. A slight twinge during a run, stiffness after prolonged sitting, or a clicking sensation during movement can all be indicators of an underlying issue. By heeding these early warnings and seeking timely medical advice, we can address knee problems before they escalate into major concertos of pain. Regular exercise, maintaining a healthy weight, and choosing activities that are kind to our joints are all part of a preventive strategy for keeping our knees healthy and our body's symphony playing harmoniously. Remember, our bodies are our instruments in the grand orchestra of life. It's up to us to tune them, care for them, and listen to their music.
Don't forget to explore the supplementary content available in the video description. They can provide additional insights and resources to support your journey. Subscribe to the channel and give the video a thumbs up to keep receiving valuable content that can transform lives. Together, we can build a community of support and encouragement. That's all for today. Wishing you a wonderful day full of possibilities. Until the next video.